So hello doctors, hello everyone, and today I will be telling you the 100 plus questions, all the memory based questions, recall questions from INI CET 2021. So first of all, uterocervical length in adult females, the answer is 7 centimeter. The fixative used in the pap smear is the 95% ethyl alcohol. Now quadruple test includes all except, so inhibin B is not included, baki SCG and trial and AFP are included. Now minimum criteria for the sperm morphology, so answer is 4. Now specific complication of twin pregnancy is twin transfusion syndrome, not IUGR, not discordant growth. Which drug is not given in the PCOS? So tamoxifen is not given in PCOS. Now which of the following is not a part of AMTSL? So early cord clamping is not a part, and delayed cord clamping is a part of AMTL. Now which of the following does not cause secondary amenorrhea? So in Kalman syndrome, it does not cause secondary amenorrhea. Now which is needed more in lactating mother than the pregnant woman? So calcium is needed more in lactating woman than the pregnant woman. Now in Barberio test, it is used in identifying the rape victim by with the use of the spermine. The Barberio test is conducted and it contains spermine to detect the rape victims. Now patient with the 5 alpha reductase deficiency, so what is this called? The male pseudo hermaphroditism. Now methods of diagnosis of unicornate uterus, so it is a multiple correct answer question. Phalloscopy and HSG are used for diagnosis of unicornate uterus. Now ovarian cyst 5 into 5 centimeter in a 26-year-old pregnant woman with 2 kids. Now line of management is observe now and follow up in the OPD in 5 to 6 months. This is the option. Now LSCS OT instrument list. So what are the list for the OT instruments? So Doyens retractor, Cascos speculum, Alice forceps, scalpel in hand, and green Armitage forceps. These are the OT instrument list for the LSCS. Now transplacentally acquired infection is CMV. CMV is a transplacentally acquired infection. Now small cell lymphoma originate from naive B cells. This is a direct question. Now choose the correct option. So BRC is an oncogene. It is a right thing. EGFR is seen in non-small cell lung carcinoma. MYC is a tumor suppressor gene. It is also correct, and HER2 is related to breast cancer. So all the options were correct in this question. Now delayed type of hypersensitivity is shown by macrophages and T cells. Delayed type hypersensitivity. Now sudden death of a 20-year-old male athlete, and the heart, gross picture of the heart was given. It is due to HOCM. Now retinoblastoma, the route of spread is direct route of spread via optic nerve, and PNH present as all except, so it presents as thrombosis, leukemia, and hemolysis, but not aplastic anemia. And this was the answer. Now the features of XXY karyotype, it is Klinefelter syndrome. So the features are the thin long limbs, narrow shoulders, and testosterone deficiency. Now transfusion related reaction prevented by irradiated RBCs. So it is what are the transfusion related reactions prevented by irradiated RBCs? So it is graft versus host reaction or syndrome. Now child with proptosis, desmin, and tumor. What should be what is the diagnosis? The rhabdomyosarcoma is the diagnosis for this and the answer for this question. Now protein of HPV inactivated RB. So in retinoblastoma, E7 protein is involved. Now in primary hyperparathyroidism, best investigation to localize parathyroid is cyst-MB scan. This is very much important. And now Colles fracture management sequence, or how to manage a Colles fracture. So first of all, we will be giving the traction, now then POP, then plantar flexion, then ulnar deviation. And now match of the followings. The Bennett's fractures, it is the fracture base of the thumb of the first metacarpal. Box's fracture, the fifth metatarsal fracture. Jones fracture, it is the base and shaft of the fifth metatarsal. And March fracture, the fracture of the second metatarsal of the foot. Now post hip dislocation on X-ray with severe pain. It is so what are the options? The CT and the what are the options for the management? CT and the 3T image, the retraction, urgent closed reduction, and open reduction and fixation of the posterior wall fragment. So open reduction and fixation of the posterior wall fragment. Now after COVID injection injury which can lead to shoulder asymmetry. So shoulder asymmetry is caused by humeral circumflex nerve injury. Now not a component of a safe strategy in trachoma. So surgery is a component, antibiotics is a component, and facial cleanliness is the component, but not the evaluation of the program. This is not the component for the safe strategy. The most common lacrimal gland tumor is the pleomorphic adenoma. This is most commonly asked, most repeated questions. Now for the nucleus for the medial rectus, this was an image. It was showing that medial rectus, and the nucleus for it is oculomotor nucleus. This is the answer. Now management of the patient with the keratin pulse and aqueous flare with high ocular pressure 38 mm Hg was given, and diagnosis was so the diagnosis is anterior uveitis. So which of the following drugs should not be given? So the prostaglandins analogs are not given because the inflammatory state in anterior uveitis, prostaglandin analogs are not given. Now classified as OCD as per the ICD international chart for the 11. Trichotillomania is classified, this is the answer, as the OCD in the ICD-11. Now risperidone off label is not used for bipolar disorders. It is used for dementia, OCDs, and PTSD, post-traumatic stress disorder. Now treatment of choice for OCDs. So dialectical behavioral therapy is not the treatment of choice. Cognitive behavioral therapy is not the choice. Systemic desensitization is not the choice, but exposure and response prevention, this is the treatment of choice for OCDs. Now time for short-term memory, so 15 to 20 seconds is the answer for that. And a patient with CBD injury post cholecystectomy 3 days after abdominal pain and fever. And so what will be the treatment for in the management line of action or the so pigtail placement is the management of choice for this, and no re-exploration and T-tube placement is not the treatment of choice. No ERCP and no oral antibiotics and sending on home. The pigtail placement is the treatment of choice. The case of coli with the increased GGT and alkaline phosphatase 3000 with acute fever. So ERCP will be done, and the patient with bicycle injury and admit in casualty with the lower abdominal pain, bruise over perineum, and blood from the meatus, and bladder is not palpable. So what will be the Foley's catheterization or SPC? So SPC will be done, and this is the treatment of choice in these cases if there is an injury and it is admit in casualty. So immediately we need to do the SPC. Now COVID-19 positive patient and symptomatic but not require admission in a hospital. After how much time elective surgery can be taken? So after 6 weeks the elective surgery can be taken in a COVID positive symptomatic patient. Okay, so this is the answer for that. And child with painless hematuria in a 3-year-old male child and mass in the right flank and the pelvis. So these are the features for the Wilms tumor. So what will the investigation of choice? CECT will be done, and during intermittent suturing angle of the needle placement is 90 degrees. This is very simple question. Now Bosniak classification grade 3 in CECT, 3/3 cyst with mild abdominal pain. So these are the features for the renal cyst and oncocytoma. Now most common cause of admission after daycare surgery is the BP, post-op nausea, vomiting, surgical pain, or respiratory complications. So most common cause of admission after daycare surgery are the respiratory complications, atelectasis, or pneumonia. Now the green color cannula is the 18 gauge cannula. This is very easy question. And baby with intermittent pain with mild upper abdominal pain, no respiratory complaints, and the chest x-rays given picture shows hollow viscera. So it is a Bosdalen or Morgagni, so it is a Bosdalen hernia. Now patient testicular mass, painless coatal swelling, 17-year-old male with no nodes of vascular mets. So what will be the management? So high inguinal orchidectomy will be done in this patient. Now lady with the abdominal pain and ultrasound multiple GB calculi, no wall thickening, no pericholecystic fluid, and CBD is dilated 1.2 centimeter, GGT is raised 5 times, and ALP 400 international units. So what will be the treatment of choice, so ERCP will be done in this case because CBT is dilated. And 4 by 3 centimeter upper quadrant breast mass by rates 4B, histopath is DCIS, and BCS breast conservatory surgery is done. Next step of management, BCS is followed by radiotherapy. This is the answer for this. And under what is triage? Triage is sorting out the patients according to the severity. This is very easy. Now insulin, what insulin do? Insulin inhibit insulin sensitive hormone lipase. So this was a direct question. Hormone lipase is inhibited by insulin sensitive hormone lipase. Now which substance RBC uses during starvation or so glucose? RBC uses glucose while starvation. Now iRNA acts through knockout, and discriminative touch is by Meissner's corpuscles. And the most typical lesion in the juvenile dermatomyositis is dystrophic calcinosis is the most typical lesion in juvenile dermatomyositis. Which of the following will you discard in the black bag? So contaminated gloves are discarded in the red bag, wrapper of the glove are discarded in the black bag. Now what is true? So sensitivity depends on prevalence of disease. This is not true. And PPV depends on prevalence of the disease. This is true. If disease is less prevalent, then sensitivity. This is not true. Specificity depends on PPV. This is not true. Now how flow cytometry is plotted? The best part for plotting flow cytometry is histogram. After that, dot plot, a scatter plot can be used. Now how to identify a diabetic case in the peripheral setting? So HbA1c is greater than 6.5, no. Random plasma blood sugar, and also fasting. The fasting, and after that random. So multiple correct answers in that. And which vaccine is associated with intussusception? So rotavirus is associated with intussusception. Now pentavalent vaccine, what it contains? Hepatitis B, HIV, DPT. These are the contents in the pentavalent vaccine. Now arrange cause of the most common death under 5 children in India. So first of all diarrhea, then pneumonia, then malaria, and after that injuries. Now treatment of choice in the sideroblastic anemia is vitamin B6. Now methyl tetrahydrofolate is accumulated in deficiency of vitamin B12. Now which molecular method uses RNA? So RT-PCR uses RNA and not Western blot and Seng's method, they don't use RNA. Now glycosylated HB detected by the ion exchange is best for HbA1c. Now cytochrome C is inhibited by all except, so methane does not inhibit cytochrome C, baki H2S, CO2 and cyanide they inhibit. Now first order kinetics, in the if the dose is doubled, what is the effect on half time and the plasma concentration? The half-life is constant in first order kinetics and plasma concentration increases. Now acute angle closure glaucoma, which drugs should be avoided? So prostaglandin analogs of antagonists are avoided. Now mannitol is given, carbonic anhydrase inhibitors are given. Now topiramate is used in Lennox-G syndrome, and it is used in the treatment in the prophylaxis of migraine, not in the treatment of migraine. So the answer is Lennox-G syndrome. Now nivolumab is used in Hodgkin's lymphoma. This is the answer for that, nivolumab. Now thiazide diuretic, which is used in the chronic renal failure, is metalazone. This is very much repeated nowadays, frequently asked. All of the following used in the PCOS except. So in PCOS metformin is not used in PCOS, and all the other drugs are used. Drug for long term of treatment of obesity, so litaglutide is used in the long term treatment of obesity. Vancomycin inhibits which step and picture of the cell synthesis? It blocks the DLR terminals. Now inhaled nitric oxide is used in the treatment of pulmonary hypertension. Now combination therapy is used in all the diseases except, so gonorrhea, it does not include combination chemotherapy. All the other drugs like TB and intra-abdominal infection, malaria, they use combination therapies. Now elderly lady on chemotherapy for metastatic breast cancer, HB is 9, TLC is 3000. Chemo is they are using paclitaxel, now presenting with fever. The lady is now presenting with fever. So which of the empirical antibiotic cannot be used? So linezolid cannot be used in a patient with the metastatic breast cancer because of the marrow suppression. It is contraindicated. Now mechanism of bronchoconstriction, epitromium are all except. So use of hypertonic saline is not a mechanism for bronchoconstriction. M2 receptor blockage and chloride blockage is used is the mechanism for bronchoconstriction. Now, patient with the TIA started with clopidogrel, but after 6 months they again developed the same TIA. So clopidogrel therapy failed due to the poor function of CYP2C19. This is very important, and you have to learn this. Now, ATT and ART should be started when they are started. They should not be started at the same time. Now, ATT started after 2 weeks after the ART. This is the right answer. Now, which of the following is approved in child with severe COVID? So remdesivir is not. The corticosteroids are approved in severe COVID in children. Now, male patient who traveled around the world frequently complains of diarrhea, and they have a slide with the leishmania bodies. So leishmaniasis is the answer for if in this question. Now, autoregulation of the kidneys, neurogenic reflexes, tubuloglomerular feedback, angiotensin 2 and sympathetic nervous system. Tubuloglomerular feedback is the mechanism for auto-regulation of the kidney. So these are the some memory-based questions, and if you remember any of them which I have missed, you can comment below and ask me the doubts. Thanks.